Good afternoon, everyone. Thank you so much for joining us for the last in our four-part series for frontline staff. Today, we are talking about artificial intelligence in healthcare. I will give just a few minutes because it takes a little bit for everybody to move out of the webinar and out of the waiting room and actually get into the live webinar section. So we'll take care of a couple of housekeeping items before while we're letting that happen. Once again, these webinars are made available through our Flex program, which comes down through the Federal Office of Rural Health. It is a grant-funded program for critical access hospitals in which we are able to bring education and technical assistance to our critical access hospitals with all things related to quality improvement. These webinars are accredited for one continuing nursing education credit each. So basically what will happen is at the completion of today's webinar, we will send out an evaluation link via email that will have all of the instructions in it on how you access the portal. You will complete the evaluation. And then you will be able to download your certificate for the continuing nursing education credits that are related to the webinars you were able to attend live. If you are not nursing, you can still get a certificate of attendance and participation for each webinar that you attend. Keep in mind, if you are watching in a group, say in a conference room or something like that, again, I want to remind everybody that if you have not each individually registered for the webinar, I encourage you to do so because that way you will actually get an email as well with the link and instructions for the CE portal, because otherwise we will send out based off of the registration emails, and that means it would go to one person and you might miss out on that. And the portal is open for about 30 days after the completion of today's webinar. So you have a little bit of time, but you can't register for it after today's webinar is over. Now, just some learning objectives for today. We are going to be talking about AI, how it is being used in healthcare, some ways that it is both beneficial, but then we also have to look at some of the ethical concerns and potential future applications. And then we've included a few case studies just to look at how it's either made a difference, maybe it didn't make a difference, but just some ways that it is being put into place in the clinical setting. So we're going to jump right in because this is a lot of information and I want to make sure that I get you out of here on time and I don't go over, but we're going to start by talking about AI in healthcare. First of all, why does AI matter? When we look at healthcare in general, we have rising costs associated with healthcare. And ideally, we're always looking for options that help either reduce workload, make things more efficient, and things like that, which can ultimately reduce the cost of healthcare that we provide. We do have workforce shortages and clinician burnout. I mean, look at COVID. We had so many people that left healthcare in general during COVID from the extreme burnout. And then we're not replacing those people. People are just not going into healthcare professions after seeing that. And so we have to do something to alleviate those issues. We have a high rate of preventable medical errors. We've talked about that over a couple of webinars that we've done already, in which about 50%, almost 50% of our errors are preventable. So what are things that we can do to help mitigate some of those preventable patient harms and reduce them? And then we also, in our very first webinar, talked about the need for very personalized care and making sure that we go towards a patient-centered care model and how we tailor things to each individual person, looking at them as a whole patient and not just a disease process. Now, what AI is not, basically artificial intelligence, these are machines that are simulating human tasks. They are not humans, by of course, by any means, and they should not be intended to completely replace humans. They should be just an adjunct, something that we use to assist us, an assisted device. It is machine learning. The systems do learn patterns from data, so they learn based off of the information that's put into the system. They're deep learning. They have neural networks for complex tasks like imaging, being able to take those radiology images or CAT scans and things like that and interpret them and actually read them. But again, they're an assistant. They're not necessarily a replacement for human clinicians and human decisions. Going back to, they are only as good as the information that's being put into the system. That's what they learn off of. Now let's look at AI and diagnostics and how it's being used in that setting. When it comes to diagnostics and treatment, we have some AI algorithms that are being utilized right now to help analyze some of our medical imaging. And these things include X-rays and CT scans and MRIs. And they do have the ability to detect abnormalities and diseases that are found on those. And they do it with some sense of accuracy. They can analyze large data sets to help identify patterns. And help us when it comes to diagnosing diseases or potentially building care plans. And then, of course, we have AI-powered robotic devices that are being utilized in the operating room right now for procedures. It may not be a surgeon who has hands on a patient. He might be utilizing a robotic tool to actually perform the procedure itself and guiding it through. And then, of course, that clinical decision support system, they have the ability to interpret findings and be able to offer suggestions as to a treatment plan or where a clinician might go and decisions that might be made. And so they are definitely there to support in the diagnosis and treatment of our patients. When it comes to care planning, they can analyze the patient data and help us create very personalized treatment plans. We talked about patient-centered care in the very first webinar and talking about being able to understand every patient based off of their cultural background, their religious preferences, things like that. And so AI, when it receives all of that information, can really help tailor some of our treatment plans and make it more individual versus some of our one size fits all in terms of things like discharge instructions that we print out. They're the same for every single patient, but imagine what it would be like if we could print out discharge instructions that truly are tailored to each individual patient. They also can provide automatic notifications to not only providers, but to patients and help fill orders as they come through when it comes to the care planning process. We can have workflow optimization with AI. We have chat boxes. How many times do you visit a website or you call in to, even your cell phone provider or something like that, and it asks, how can I help you today? You're talking to a chat bot. And those help answer some of those commonly asked questions that frees up our clinicians to be able to actually provide patient care or do some of the other things that they need to do versus answering the same questions over and over. But it also helps provide patients with a very quick, easy access when they have questions. So the chat boxes and things like that can be very, very beneficial. They can assist with scheduling and preparing a patient for their visit. How great would that be to have a chat bot or an AI assisted device to be able to work with the patient to ask all the questions that need to be asked and gather all of the information before they come into the hospital for a procedure. And then there's the ambient listening. There's so many documentation tools out there right now being marketed specifically for the purpose of capturing all of the dialogue between a clinician and a patient and being able to transcribe that accurately, which allows the clinician to have more eye contact and be more engaged with the patient when they're talking to them. That was also something we talked about in patient-centered care as far as having that active listening and making eye contact rather than be asking questions and facing the other direction so you can type on a computer at the same time. So there are lots of tools right now out there that are trying to help provide this in the patient care setting and make a few things a little bit easier on clinicians, but increase the accuracy of the information that we collect when having those patient interactions. Now, there are a lot of AI products currently in use, and I put a few in here to talk about just because they're great examples. If you're not familiar with some of them, of course, there's so many out there. I don't think we necessarily realize just how long AI has been in use, but it's just exploded through the last couple of years. When it comes to our electronic health records and predictive analytics, Epic Systems actually integrates AI into electronic health records, and this is utilized to help take some of that patient information and help predict those patients that may be at higher risk and those that may actually be at risk of coming back as a readmission, because we all know that readmission rates can impact your hospital in terms of a financial perspective. And so we're always looking for ways to mitigate the readmissions and avoid those. So how great would it be if we can predict the patients at higher risk of readmission, and then we can better tailor our plan of care to help avoid that readmission later on. That way we know these patients may need a little more education than someone else, and we can get on that early from the point of admission versus when they come back to us. From an administrative perspective, Olive AI helps automate prior authorizations and your billing process and some of your scheduling. And if you have not had to sit on the phone to perform a prior authorization for a patient, this can be very time consuming. And a lot of times when you're trying to get authorization for something for your patient, you may be talking to someone on the other end of the phone who does not have the medical background and knowledge to fully understand why a patient would need whatever it is that you're asking for. And a good example I can give from my own experience is having trauma patients on my service who really needed to go to specialized inpatient rehab. And I'm trying to explain why this patient with multiple traumatic injuries needs inpatient rehab to someone who may have a psychiatric background and not have any experience treating a trauma patient at all. And so having some of these AI tools to help with that process can help free up some of your man hours and your resources to do other things. In turn, this does help reduce some of those errors. It saves that staff time and allows them to perform some of the other tasks at hand, rather than sitting on a phone or making multiple phone calls trying to get to someone who can help you make the right decision. When we look at hospital flow and optimization, Caventus optimizes our OR scheduling, ER wait times, and discharges. One of the things that we look at in terms of a quality metric for our critical access hospitals is our ED throughput time. So we look at the amount of time it takes from the point a patient walks into your emergency department to the time that they are discharged. And I know that CMS right now is looking at modifying that metric to look at it a little bit more specifically in terms of patients who wait more than an hour to be seen, patients who are held over in the emergency department for more than 4 hours before they get admitted, transferred, or moved to another point of care, and then patients who spend more than 8 hours of time in an emergency room in general. So we're looking at these ER times and wait times and our discharges and things like that from a quality perspective. Well, now we have AI tools that are helping to optimize those situations and also help us improve. They support resource allocation in real time versus going back after the fact and looking at how we could have done things differently to allocate our resources to improve the process. When we look at patient monitoring, AI can absolutely be incorporated into more remote monitoring of our patients in real time also, instead of potentially looking at things, after the fact. Think about having to have patient monitors, somebody to sit there and watch your monitors for your patient. If you have a monitor tech in some scenarios, you may not have an ICU in your hospital, but some do, and having to have extra staff on hand to monitor patients or have virtual sitters. All of these things, again, lots of man hours, it's time consuming, and we do have tools out there to help perform these duties and make us a little bit more efficient in the duties that AI cannot help manage. Wearables, how many of you have some type of a smartwatch? I have mine. I don't have an Apple Watch. Mine is a Garmin device. It is my dive computer, but it's also does so many other things. It's a complete fitness tracker, and it monitors my steps every day, how many calories I burn, my heart rate, and everything is on the front screen every time that it pops up. But some of these devices now are able to detect atrial fibrillation or give fall alerts. And look at your Fitbits. Those are also, a lot of people are using those now for fitness in general, but they track our sleep. There, we're able to perform better in terms of sleep hygiene and modify things so that we are getting more rest when we need to get that. Our heart rate, again, monitored. You can even monitor your O2 sat with some of these devices. So there's a whole lot of data that are in these smart devices now that we basically wear every day. When it comes to cardiac monitoring, now there are blood pressure monitors. You may have one, or some of your patients may have them at home, but you have blood pressure monitors that also have the ability to not only take your blood pressure, but you can put your thumbs on the little sensors, and it will give you an EKG reading in real time. It can send these off to your primary physician if you have it linked to them. You can keep that in and store that information so that you go to your follow-up care and you can actually take it to them and show them what you've been. And there's actually some data to show that they're fairly accurate in terms of being able to detect some arrhythmias and being able to notify not only a patient that they may be having something that they need to seek medical attention for, but being able to keep physicians' offices aware as well. Sometimes they're good tools. If you've ever taken your car to a mechanic and you go there telling them, hey, it's making this noise, chances are it's probably not going to make that noise when you go. The same thing when some patients go to the physician and say, my heart was feeling a little bit funny the other day, but then they do a 12 lead and they just don't capture it. Well, now we have devices that actually can, where they can take that in and show that to a physician. When we look at diabetes care, we have continuous glucose monitors now with AI prediction abilities to where they can actually monitor that patient for a period of time, learn from that patient's data, and be able to predict when a patient may be headed towards a really elevated glucose level or a really low glucose level. And this is huge. You hear of service dogs that are being utilized for this. They are able to actually sniff out when a patient is having high levels of glucose or an impending drop in blood sugar. And so service dogs are extremely expensive, but the possibility exists that somebody could have a device like this, and it would be of great benefit. Even more beneficial than a service animal in some cases in terms of portability and being able to go places. Now, diagnostics, going back to some of our diagnostic tools, when it comes to medical imaging, ADOC helps to detect some of those brain hemorrhages, pulmonary embolisms, or fractures, and things like that on our scans and our studies. And it isn't necessarily that we're utilizing them solely for diagnostic. It may be a backup tool. A lot of times when you have radiology reads, they're going to have a second physician who will read the exam as well, just to make sure that we're constantly looking out for misreads and things that are missed on radiology exams. Well, some of these AI tools can take the place of that secondary person and provide that overread. Arterius helps with cardiac MRI interpretation. In terms of pathology, we have assisted AI devices that can help identify cancer cell detection on biopsy slides. And this does help improve our consistency and reduce our error rates and our missed rates for diagnosis of cancer, because certainly there are plenty of cases out there in which somebody has had a misdiagnosis or their cancer has completely been missed along the way. And then by the time it's caught, then they're far behind the power curve in terms of a treatment plan. Genomics is another place we can integrate sequencing and our clinical data. This helps those oncologists really, really target their therapy and their treatment plan to a specific patient. Imagine being able to take the patient genome and sequencing and be able to completely develop their course of action specific to that patient, and increase their chance of recovery and cure of cancer or other disease processes, rather than that one size fits all, everybody gets the same medication and the same treatment plan. where it's going to help some, but not be optimal for others. We have devices for eye care. The IDX-DR, it's under a different name now, but this is an autonomous AI tool to help detect diabetic retinopathy. You used to have to go to the eye doctor and go through the whole eye dilation where you can't see anything for hours afterwards, and you have to wear those really big dark sunglasses and things like that. You can go to the eye doctor now and have some of these AI tools in place to help do all the diagnostic part that you need on your eye exam and never have to undergo the dilation process. This device was actually FDA cleared back in 2018. So
Whoa.
this just goes to show you how long these tools have been in place
Wow.
and how they're being used and in the clinical setting. We would not be doing our due diligence if we didn't talk about benefits and limitations of some of these devices. Clearly, some of the benefits are improved detection rates. It does reduce the workload in some capacity. But in terms of limitations, you still can have false positives and that algorithm bias. It goes back to, again, AI products learn based off of the information put into the system. And so if what is being put into the system isn't 100% accurate, then it may go down the pathway and give you false positives or some algorithm bias. So we have to take that into consideration. AI augments our radiologists and our pathologists. Again, it should be an assisted device, but it should not necessarily replace them any more than it should completely replace our clinicians in terms of diagnosing, treatment plans, and things like that. So when it comes to supporting patient care, there are absolutely uses for supporting patient care with AI. It does provide probabilities and alerts, and it helps with those evidence-based suggestions based off of each individual patient information that it obtains. So it can, again, that constant learning process, and it's gathering information, and it can pull up all of the current evidence-based practice, and then it can make suggestions on the plan of care based off of the information it has for that individual patient. Again, reducing that cognitive load by analyzing large data sets. If you had any idea how much data your quality person collects in your hospital, it makes your brain hurt sometimes when you start looking at how many data metrics you have to monitor on a monthly basis and report all of that data. So some of these AI tools are able to take that data and help analyze it for you, and it helps make your processes a little bit more efficient. And it certainly reduces some of the load on one individual because our critical access hospitals do not have a quality department that consists of multiple quality improvement nurses and a couple of data analysts and a whole support staff. You're talking about one person who may have to do all of that. AI also helps highlight some of those blind spots that we get. No different than driving your car when you need to make a lane change and you're supposed to look over your shoulder to make sure there's nothing in that blind spot because you can look in the mirror, but you just still might not see something. We have blind spots. Sometimes we get tunnel vision and we start losing sight of some little pieces of information during our plan of care process. And so AI tools can help highlight some of those blind spots and help us go back and do a double check. Like I said, it's just a checks and balances and an assisted device to help us think of some of the things we might be missing or things that we should be focusing on. It reduces those administrative tasks, again, going back to some of those documentation tools where it can totally transcribe the interaction between a clinician and a patient. And this allows for more active listening where you can literally have eye contact with the patient and really hear what they're telling you versus trying to type at the same time and come up with the next question before they're even finished answering the first one. Translation tools, certainly we have so many language barriers across our populations now as we become so much more diverse. And so the translation tools are absolutely helpful in terms of of eliminating some of those barriers and making sure that our translation is accurate. We've talked about in terms of patient-centered care and quality of care and translation and making sure that, guaranteeing you can use a family member, but you cannot guarantee that they are translating things appropriately. So sometimes these tools help eliminate some of that disparity there. And of course, the chatbots, again, being able to handle some of those routine, frequently asked questions, which gives us the ability to focus on some of the tasks and the more meaningful care that we need to provide, rather than having to spend so much time on the same questions over and over again. Think about the patient. It never fails that the family is going to have a lot of questions with the patient, but it seems like physicians always round or come in, specialists, when they're all gone. As soon as they walk away to go have lunch, that's when they're going to come in. So imagine having a chatbot where they could come back and be able to put the questions in there and answer them and get the information they need, without having to sit there and call somebody back into the hospital. Helping to promote compassionate care, again, it integrates the lifestyle data and information from a patient, from their cultural background, their religious preferences, dietary restrictions, things like that. And it is able to not only take all of that information, but take their medical information and put it all together and provide a more holistic insight so that we really are taking care of the whole patient and not just a disease process in that moment. Continuous monitoring provides that reassurance beyond hospital visits. Again, going back to some of those tools like cardiac monitoring and things like that that can be done remotely, that the patients can have in their home. And that kind of helps provide a little bit of reassurance and comfort to the patients that they do have that at their disposal and access to those things. And it, of course, through those tools, empowers our patients to engage more in their own care, be more involved in that process and making decisions, and gives them ownership over some of the things that, maybe they do want to do, they don't want to do, but at the same time, it can also help empower them to be more engaged and compliant with their plan of care, and ultimately see them avoid being that patient that's in and out of the hospital. And that, we know, decreases their quality of life. When someone is constantly sick or not feeling well and unable to do the things that bring them joy, that impacts their quality of life, which impacts their mental health and causes them to be that patient that comes back over and over and over again. And when we can improve their overall health and well-being, that's just in general good for our communities. Guardrails against burnout, again, reducing clerical burden and helps protect some of that clinician well-being, and frees us up to spend more energy on being empathetic and building that trust relationship with our patients, and really spending the time doing education, because that's a huge piece in terms of the teach back that we do, and educating our patients and how we instruct them on their follow-up care and things that they need to look out for and be aware of. And when we have the time to do that, of course, we know our outcomes are better. And it absolutely supports that patient-centered care and compassionate care delivery that we talked about in our first webinar a couple of weeks ago. Now, looking at a couple of case studies, we have to look at where AI has been used and what the outcomes were, whether it was good or bad. Some ways it may make a huge amount of improvement. Some ways not so much, but we definitely have to take a look at those things. So we have just a couple of studies here to show you some examples of AI actually being used in practice and what the outcomes were. So the first case study involved breast cancer screening, and there was a high rate of radiology workload and missed cancers. Again, going back to having to have multiple people view scans to determine, to make sure that one person didn't miss a diagnosis or miss something on a radiology film. And it's kind of that checks and balances. And what they did is they utilized an AI triage system in a very large trial. You're talking more than 80,000 women. And they compared the scenarios where you had an AI looking at the human reads, kind of an AI use and the human, and comparing the two, looking for potential missed cancers versus the traditional double reading by two human clinicians, to see what the difference was and if it had an impact in the overall outcome. What they found in this trial outcome is that while the cancer detection rates remained similar, there wasn't a huge difference. There was a 44% reduction in radiologist workload. So when you talk about the stress of a radiologist of having to sit there and read so many films over and over again, it's kind of like you get a little bit of eye fatigue and everything starts looking the same after a little while. So you can totally understand how a misread could happen. So while the detection rates may have remained the same, you reduce the workload by 44%. So not only does that take some of the stress off of your clinicians, and give them a little better work-life balance, if you will, in terms of their job role in itself, it also reduced that workload of having to have the second clinician to do the same exact thing. And that redundancy comes at a cost of paying two clinicians to do those films. The clinicians ultimately did retain final decision and authority over the reads. But again, this one is an example of that workforce solution, but not necessarily an outcome solution. Our next example study is in diabetic retinopathy, and it's going back to the device that I mentioned earlier that was actually FDA approved back in 2018. And the challenge was access to eye specialists in primary care. In small communities, you may not have access to the high level eye specialists or cardiac thoracic surgeons and people like that. You think in terms of geography and having to travel to the nearest location to get to those people. How good would it be for patient outcomes to have access to a tool like this, who can do early detection and help you navigate and get to the specialists you need? So basically, this helps provide those autonomous AI results from those retinal images on the spot. And the outcomes here is that they had a high sensitivity and specificity, and they had immediate results that allow very timely referrals. So it isn't like bringing a patient in for a routine eye exam and then having to schedule them for an appointment with a specialist in the nearest big city where they had access, and then get them to that specialist who would then perform the studies and then get these results. So a lot of time passes. This way, they have immediate results, a timely referral, and they can help manage follow-up and get patients where they need to be a whole lot faster for treatment. Our next study was a sepsis early warning. All of our facilities are focused on sepsis in terms of early diagnosis and being able to treat patients quickly. We know that is essential to patient outcomes. So in this study, they utilized an AI system to monitor the patient's data continuously, and it made alerts to the clinicians of possible sepsis. Now, the outcome here, this was a multi-site study, and the outcome here actually resulted in a 4.5% reduction in mortality. And when we're talking mortality rates, we're talking about patients who suffered a bad outcome, and these would be our unexpected patient deaths and things like that as a result of sepsis that maybe went undiagnosed and untreated, resulting in significant complications. This absolutely showed improved early recognition and treatment. And the AI provided the prompts, it provided the alerts, but the clinicians made the treatment choices. So again, you're not completely replacing your clinicians and their decision-making process, but you're at least giving them that early warning. And 4.5% reduction in mortality is a pretty significant result when you look at something that involves a negative patient outcome. And then the case study number 4 are wearables. Again, looking at the Apple Heart study, and this was detecting atrial fibrillation in large populations, where they looked at over 419,000 participants, in which the Apple Watch looked at irregular pulse notification. So the participants were actually notified if the watch detected potential atrial fibrillation in their heart rhythm. We know that atrial fibrillation can lead to some serious potential complications and outcomes for patients if not detected and treated. Now, in this study, they had a little over 0.5% of participants received alerts from their device, and about 34% actually had atrial fibrillation confirmed on an EKG follow-up. So the AI triage helped funnel patients to clinician for confirmation. So when the patients get that alert, they're notified. It prompted them to notify a clinician and actually go to the doctor and get confirmation of whether or not to have atrial fibrillation or not. 34% is actually, you can interpret that that's a pretty decent amount of people that had atrial fibrillation confirmed. Imagine those patients not having an alert like that, not having a device that would clue them in that something like that was happening, and it went untreated, and they potentially suffered a significant complication or outcome from that. So we have to consider in all of these things that look at some positive impacts of AI, we still have to consider our challenges and our ethical considerations because there is a lot around AI. Where does it go? How far does it go? And then how do we manage it? In bias and fairness, the systems can inherit biases from the training data. Again, that goes back to they're only as good as the information put into them. And some individual person has to start that process. So they can develop the bias from the individual doing it. If you've used ChatGPT, I challenge you, it's kind of interesting. If you take two people and each person goes into ChatGPT and types in, I'm having a disagreement over XYZ, and this person believes this. What do you think? An AI tool can detect your position on the matter. And two people basically putting in the same disagreement are going to get completely different results from an AI tool like ChatGPT based on their perspective, because it all starts with the tone and everything of how you put the information in there. So we have to take that in consideration. We do run the risk of perpetuating some of our healthcare disparities, and there is a great need for diverse and representative data sets to make sure that we avoid some of these things. Privacy and security, very much, we require a vast amount of patient data in terms of AI. Like it takes everything in. So there's a lot of information in these AI tools. And as with any other piece of technology, there's the risk of data breach and unauthorized access of patient health information. And so we have to make sure that HIPAA compliance is of a top priority, that the encryption is there so that in the event you have some kind of a breach, people are not going to be able to access personal protected information. It also goes to proprietary information. Consider your businesses or companies that develop products and apply for patents and things like that. There may be proprietary information involved that AI tools can inadvertently store, leak, and then that, of course, would get out potentially in public. Accountability and liability. Who is responsible when AI makes an error? There's at a recent conference I went to, one of the discussions on AI was really interesting in terms of a study that was done in which they found that the AI tools had actually done a more accurate job in diagnosing and developing treatment plans for the patient. And so, of course, this causes concern of, does that mean it's going to replace clinicians? But then the conversation went down the pathway of clinicians have to go to school, you have to undergo training and licensing, and you are held accountable to your license and your practice. So if you are negligent, not only can you be sued, you can lose your license and you can be held accountable for that. Well, what about an AI tool? Who are the people putting the information into the AI tool to prompt the learning of that AI tool? Are they licensed clinicians? Are they pulling information from a textbook? And so there's a lot of questions about who's going to ultimately be responsible if an AI tool does make an error. So we have to have some legal framework for the clinician versus AI accountability. And we definitely need to consider some very clear regulations and guidelines for these processes. Trust and adoption, there's a lot of skepticism in terms of people in the healthcare profession, and fear of replacement. None of us want to lose our jobs. We do not want to, we see other industries like the automotive industry, and things like that that have gone automated, to where you've got robots basically building a lot of the car pieces now, where you used to have humans performing that function. And so none of us want to be replaced. None of us want to lose our positions. And so there's always a little bit of skepticism. I am also thinking about these translation tools when it comes to documentation. Yes, they're taking that conversation and people are maybe going back and using some type of a tool to type up their progress notes or their nursing notes. But are we taking the time to read that for accuracy? It's still not our words. It's an AI tool putting it into words. So how does that work? So a lot of skepticism there. Patients may not trust AI-driven decisions. We have a lot of people who are not technologically savvy. They're not big on all of these technology advances, and so they don't want to see AI. And so we have a lot of patients that may not trust the things that we use or the things that are at our disposal. And of course, transparency and explainability are absolutely essential. If we are using any type of AI tools in the patient care process, whether it is for documentation or anything else, we have an obligation to make sure that our patients are aware of that and that they understand what it's being used for, how their information is being protected, and that it's not taking the place of their actual provider or clinician who's making the decisions. Now, what are the future directions of AI in healthcare? I like the image there with the little red dot because there's a lot of different ways it can go. And some of the pathways might not be an open pathway. I mean, really, this can go in any direction. And so what are some of our future directions and where we can see it? First of all, think about the ability to create a digital replica of a patient for simulation. Imagine if you have a patient come in with a very complicated medical condition, and we can create a digital replica and actually test a treatment option on that patient before we do it to the patient. And that way we can see what the outcome could be. To me, that is astounding. I think that it could go a long way to reducing the cost of healthcare because maybe we wouldn't spend so much time doing things that did not work. Allowing the testing of those treatments virtually before real world application, and absolutely being able to personalize our medicine on a scale that we just can't even comprehend right now when it comes to treating things like congestive heart failure, cancers, and what about diabetes and all of these other things when we can absolutely use these tools for predictive medicine versus having them make the decisions in the moment. Drug discovery and design using AI models, again, automating clinical documentation and natural language generation, being able to truly tailor things like our discharge instructions to individual patients. Imagine being able to go to your computer to print out something for your patient and being able to put the information in terms of your patient's primary language, understanding what their literacy rate is. Maybe they only have a fifth grade reading level, and being able to put that information in and having an AI tool that will generate information based off of those things that your patient can more readily understand and go home and actually keep up with their plan of care versus go home and become so overwhelmed that they just don't do any of it and end up back in the hospital. I mean, I think that it does open up possibilities there for true tailored educational materials based off each individual patient. When we look at regulatory trends, the FDA is advancing guidelines for AI based on medical devices. And I think this is absolutely necessary. I think we have to take a look at these things and make sure that we have some regulations in place. Again, it goes back to that liability, and who's to be held accountable when something does not work well or something goes wrong. In the EU, they have an AI Act that's shaping some standards for the safety and transparency of the use of AI in their healthcare setting. And we do see from a global perspective that there is more momentum towards responsible AI use in healthcare. It's here. We're going to have it. We're going to use it. We just have to do it responsibly. And to close this up, so we have a few minutes for questions, because I'd absolutely love to hear input from all of you in terms of if you're using AI tools now, what you think of the AI tools you're using, or how you feel about the use of AI in healthcare, because I think this is a topic that we're going to see a lot. I know I see a lot of this on the agenda items for breakout sessions at conferences now, but it is transforming healthcare in a way that we diagnose, the way that we develop treatment plans, our workflow processes, monitoring of patients. It's definitely transformative, and I think that it is going to provide some benefit. I don't know that we necessarily it will ever replace true people and that human interaction, but I think we can absolutely use it in ways that's positive. The case studies do show that AI augments but not replaces the clinical expertise. It's an assistive device, but not necessarily a replacement, again, for that human interaction and the empathy that you get, the compassion that you get from another human, that you're not going to get from a computer or some type of AI device. It does support compassionate and patient-centered care. And this is definitely the model that we're going towards, and something that we need to start moving in that direction. But again, looking at the future of healthcare by being able to do those predictive models and test out treatments and stuff like that on individual patients before you actually do it, to know whether or not it's going to work. I think that that would be an incredible tool to have. And so with that, I will stop and see if there's any questions. I'm going to take a look
Yes,
at the
we have
chat
one in the
box.
chat box. Yes, Sheila, I was going to direct you to the chat box.
Yeah, I see that. So for small to medium hospitals, which department of service do you recommend we start in AI application, and how to grow from it? Wow, that's a good question. I think in a lot of places, I know things like robotic surgery, I think we're kind of one of the first places that I think of in hospitals where we saw that, but it is very expensive to go the route of robotic surgery and stuff. But I think probably one of the first places we're going to start seeing it is going to be in some of our documentation tools. I mean, that's just my personal opinion. I would have to do a lot more research on it to see what everyone else is doing, but clearly it's being used in clinical areas that, in terms of diagnostics and reducing workforce and workflow, like the radiology misreads and things like that. As far as buy-in from staff and providers to embrace it, I think that just takes time, and I think being able to show them the benefits, but at the same time being able to make sure that you educate that this isn't because we're looking to replace you. This is just an adjunct tool to use, just like our stethoscope is to listen to breath sounds and things like that. This is an adjunct for you. It isn't to replace you, and making sure that that is up front in the conversation before you just go and say, hey, we're going to use these AI tools to do your documentation. Because the first thing somebody is going to see is, okay, they're taking away one of my responsibilities, and what responsibility is next before I don't have any responsibilities and you just get rid of me. And so I think it goes back to leading with it from that positive perspective of, this is a tool to assist, it isn't to replace. And at least give it a try. If it doesn't work, we can come back to the table and say it didn't work, but let's see how it goes. So I think it's going to take some time. Like I mentioned, there are AI devices that have actually been in place for a very long time. It is not necessarily brand new. AI has just exploded over the last few years. And so I think that we've undergone such a rapid advancement that it's going to take some time for us to mentally catch up to that before we really, really jump right on board. And I'm one of those people that is a little hesitant. I full transparency. I'm definitely one of those people that's a little bit transparent. Hesitant, and I've gotten on a few AI tools just to try it out and check it out. And I think it's pretty crazy that you can have a conversation with an AI tool, like you're having a conversation with the person. So it is a little uncomfortable, but I do see that there is some great benefit for it in the future. And Laura, let's see. Laura put some resources in the chat box, but it looks like they only went I'm going to see if I can share these to everybody.
I got it,
Um,
Sheila. I will share it.
Perfect. Perfect. Oh, I just clicked on the link and went to open it up. So you might be looking at that. But it's just some resources from Joint Commission talking about AI and everything else. Let's see. Renee says you're just talking about this the other day with your CMO. Yeah, hesitant at first, and then let's see. See, I think that's I'm big on listening, and I think that when you can sit there and have a conversation with someone and look them in the eye and be engaged in that listening process, that is so much better. The scheduling of patients now is one where clinicians just don't have a lot of time to sit there and talk to their patients because they have to document everything and they're in a hurry and they're only can address one thing. But I think it's a good tool for things like that. I do think we have to make sure we take the time to read what it puts. And I think you say that it can be time consuming because of the extra talk. And things like that. Sometimes there's a lot of the conversation that is absolutely not applicable to what you're there for. But I still think we also need to review it for accuracy in terms of, do I feel like that is the conversation I had with the patient? Do I feel like that is the patient words, or did it in any way interpret it different or document it different? Because I think that having that accuracy is really, really important. Um, and Nina got those resources in there into the chat box for everybody to download. Any other questions, comments? Anybody else using AI tools for anything? Even in schoolwork now, you see a lot of controversy because people are using AI tools to write all of their papers and everything. So now professors are having to learn to identify AI generated things. They're talking about how that can impact our learning process. So imagine in medical school, nursing school, or things like that, where you have to study a disease process and you have to write a paper about it. If you're utilizing AI tools for all of your work, are you really learning and retaining that information? So that's somewhere that they're also looking at identifying what is potentially an AI generated piece of work versus what is truly the student's work to reflect the knowledge that they have. So I think there's a lot of questions along the way, but I do see that there can be some benefit if we use it correctly, we monitor it correctly, and we evaluate it. Any other questions? AI generated policy templates helpful, absolutely. This is the thing where I see that's why I say I think that there's definitely some use for it when it can generate your templates and stuff, because talk about being able to build consistency across your organization. And we know that when we build consistency, we reduce the likelihood of errors and things like that. So that can absolutely streamline processes and things of that nature. And again, I go back to patient education because to me, I just can't even imagine being able to get educational tools that I can give to a patient that truly are tailored to that individual patient. And Laura put in there that one of the THA endorsed partners, GlyTech, uses AI to reduce hypo or hyperglycemic events. And again, um, I gave the example of a service animal that helps to predict some of these things. And we have service animals that can help predict seizures and hypoglycemic events and things like that. They're fantastic, but service dogs not only cost a huge amount of money and training, but then the care and everything associated with having those, and a lot of people can't afford them, or they can't manage something like that. But being able to have a tool, some type of a device or a tool that's AI learning, that can truly learn that patient, and be able to predict these events, I think is incredibly useful. This is I always provide my contact information. If you have any questions, comments, or anything else, please feel free to reach out to me. And I'm happy to answer them for you or get information. If I do not have the answer directly, I certainly will visit with my colleagues in the office, or look to find the information for you. And also, if you want any type of follow-up information or things like that, we are always available to support you in any way possible. We absolutely appreciate all of you and everything that you do to take care of patients in our rural areas. We know that you face a lot of challenges in doing so. It's not as easy to provide healthcare in the very rural setting as it is in our large cities like Austin or Dallas, Fort Worth, where we just have a lot of resource. So we absolutely appreciate you and respect you for what you do. Next steps, you again watch for an email. The email will come from the email address there. It will be khaki@thafoundation.org. The instructions and the passcode for the CE portal are going to be attached to that email. And then basically what you do is you go in and you're going to have to copy the passcode, go to the link, and then if you haven't been there before, you'll have to put in some information so that you kind of have an account there. Put in the passcode. It will take you to the evaluation form for these webinars. And then basically you will select the webinars that you attended live. You'll complete the evaluation, and then you will get a CE certificate at the end if you are nursing, for the amount of CEs for the webinars you attended, up to 4 CEs for the webinar series. If you're non-nursing, you will still get a certificate at the end that you attended the webinars and all of that good stuff. Please provide your feedback to us. We want to hear anything that we did well. We also want to hear things that we could do better. If you have other ideas or educational needs, please document those. I read all of those evaluation reports to look for ways that we can do better, ways that we can bring you other educational things that you really are in need of, because we certainly want to make sure that any education we provide is meaningful, it's useful, and it's actually what you need versus things that you do not. So please provide feedback. I know it's easy to go in and just click down the road to get your certificate, but we definitely appreciate all the feedback that you can provide. We thank you so much for joining us today and for being a part of this webinar series. And so with that, we've got just about a couple of minutes left. You might have time to grab a quick drink before you go back to work. But thank you once again, and we look forward to seeing you on our next series. Y'all have a great rest of your day.